Hello students, so today's topic is development. Like I told in the last class, there are few points in pediatrics which have to be very strong, one among which was our growth. We'll discuss about development today, a normal development. The next class would be much in detail and professional competencies of developmental delay. And after this, we will touch upon the nutrition. These three domains should be very strong for a good pediatric knowledge. So let's start with development today. So this is how our class will go. First, we will know what is the definition of development. Then we'll go through the laws of development. Then we'll touch upon the different domains of the development. And for the development to happen, we know there are few newborn reflexes which have to be known, which have to be lost. And then we'll talk about the normal development and few special words that all of you should know and which are usually asked in most of the vivas and even NEET PG exams. Then we'll talk about the approach to a developmental delayed child and how do we manage a developmental delay. So this is the outline of our talk. So let's start with development. This is the definition of development. So when do we call or what do we call as a development? It is a process of functional and physiological maturation. How does it happen? With progressive increase in skill and capacity to function. Like already discussed in the previous class, growth is just increase in the size, whereas development is maturation of that organ, acquiring new skills in the child is called as development. Now, for this to happen, there should be maturation and myelination of the central nervous system. Plus, this not only involves gaining skills, it also involves psychological, emotional, and even social development. That is why even autistic spectrum disorders, where the social development is the issue, is included in developmental delays these days. So basically, this is a qualitative change, whereas growth is a quantitative change that we see. Now coming to the laws of development, or also called as principles of development. Now you should remember that there are 6 laws of development, whereas there were 3 laws in growth. So the 6 laws of development is, one is development is a continuous process. Hence, it begins from in utero and progresses till maturity and even sometimes up to 40 years of age. This depends on maturation of the CNS. So, depending on the cranial central nervous system and the maturation of this development pattern changes, there can be delays, there can be different things in development. The third important thing is sequence of milestone is almost same in all of the people. So that means a child will always have neck holding first, then only the child will have rollover. Or a child will always sit first and then only start to stand or walk. So the sequence of milestone will always be consistent. Although it varies from person to person and the timing might vary a little, grossly it will be the same. Then is the cephalocaudal progression. Just like growth, even the development has cephalocaudal progression. That is, head control will always come first, followed by the trunk control, because of which the child sits, and then the leg or the appendicular skeleton that matures, because of which the child starts walking. Similarly, in an individual limb, the proximal control always comes first. That is why the child will have hand regard first and then have mature pincer grasp. So, proximal to distal development happens. Even when along with the cephalocaudal progression, it is always proximal to distal development of milestones. These are the 4 developmental principles. The last 2 principles are the primitive reflexes or few newborn reflexes that are there, that must always be lost before a new skill emerges. That means the newborn to become a adult or the newborn to acquire skills. So the primitive reflexes has to be lost first before the new skill emerges. This is the 5th principle of development, and the last by more specific action. As we go through the development, you will understand all of this. So initial mass disorganized activity matlab, before a mature pincer grasp, the child will always try to hold with the hold a ball with both the hands. That is the bidextrous approach. So that means this is a disorganized activity. Going and catching the ball with both the hands and then slipping away, then trying to catch again. So it is more disorganized. As the child grows, it will be able to catch a pen or a ball with a single hand. So this is a more specific action. So these are the 6 principles. This is the main building stone for our class today. Next, coming to few words, that is developmental dissociation and developmental deviance. Now, whenever we talk about development, these two words come very often. Now, deviance means acquisition of milestone in a sequence that is different from usual. For example, generally a child, once it gets neck control, it will sit on its own, and then once the sitting is achieved, then the child will start crawling and then stand. So in few babies, it can so happen that from the sitting, it can directly go to a standing position. The crawling and creeping can get skipped. Now this is called as deviance. It can be normal, it can even sometimes be a pathological finding. Now dissociation means when milestones are compared between different domains. So if there are different domains, for example, a gross motor, fine motor and language, gross motor is fine, but language delays a lot or language is lacking a lot, then it is called as dissociation. This also can be normal or pathological. We'll get back to these points again. Now, before going further into the domains of development, you should know about reflexes. Now, like I told already, the neonatal reflexes are the primitive reflexes. These should be lost to gain new milestones again. Please keep telling me if I'm audible or no. The camera keeps hanging again and again. Yeah, okay. So, all right. Okay. So the reflexes, there are few reflexes that you all should know. One among this is palmar grasp. I'll go to the next slide. First, we'll go with the most important reflexes, that is must know. So coming to the rooting reflex. Now, rooting means whenever we touch the corner of the mouth, the baby turns towards the stimulus. So now imagine, why is this helpful? This is helpful for latching on the breast. That means if the child is taken close to the mother's breast and is stimulated, then it will turn towards the breast so that it can latch on easily. So this is called as rooting reflex, which appears as early as 32 weeks of gestation and is almost disappearing by the end of 1.5 months. Why is this important? So this is what is the demonstration of rooting reflex. As we touch one corner of the mouth on that side. Okay, thanks. So the rooting is needed for latching. So by the end of 1 month, child is mature enough to regulate its own needs. So that is why rooting disappears by 1 month. Now this is ATNR, or also known as asymmetric tonic neck reflex or fencing reflex. Now as the position you can see, whenever you turn the head of the child to one side, the ipsilateral, so the ipsilateral limb extends. So the ipsilateral limbs, the upper limb as well as lower limb extend, the upper limb more than the lower limb, whereas the opposite side flexes. Now imagine why this is very important, because the head neck control is not there. If a newborn doesn't have this ATNR reflex, he can roll on and smother himself. So that means for the rolling over to happen, ATNR should disappear. So that is the importance of the fifth developmental principle, that is newborn reflexes should disappear to gain newer skills. So persistence of ATNR beyond 5 months, it says that there is CNS problem or early cerebral palsy. So it appears by 35 weeks of gestation, disappears by 3 months, maximum we wait till 4 or 5 months, after which we have to intern. So next is the Morose reflex. Now Morose reflex is the favorite question of all the examiners. They always ask you what are the 5 components of Morose reflex and how do you elicit it. So one way of eliciting it is take the head of the child on your palm and cause a 30 degrees drop. So just drop the head of the child by 30 degrees, following which you see this, that is abduction and extension of the arms, followed by opening of the hands. Then this is followed by a embrace equivalent or a hug equivalent, wherein there is adduction and flexion of the upper arm, and then followed by a cry. So 1 and 2 becomes the first 2 components, that is extension and abduction, followed by opening of the hands. That is 1 and 2. Adduction and flexion is 3 and 4. Fifth component being the cry. So if all these 5 components are there, then we call it as a complete Moro. So complete Moro comes only at term gestation. That is more than 37 weeks of gestation, you get a complete Moro. But Moro appears very early, 28 to 32 weeks of gestation, Moro appears. till the term it is immature. That means all 5 components won't be there. Followed by a disappearing around 6 months. So till 6 months, Moro's will be there. The importance of Moro is if Moro's reflex is complete at term gestation, it tells that the CNS is normal for the child. So this is about Moro's reflex. There is nothing like what disappearing does. Next, coming to the grasp reflex or a palmar grasp. Now we all know this is the most fancy reflex, giving rise to so many baby photographies that we have. So the moment you have a touch on the ulnar side of the baby's hand, to touch the ulnar aspect of the newborn baby, the baby closes the fist. Now this is basically to regulate its behavior so that it clasps any object that comes on its way. So this is the grasp reflex present in newborn. Now why should this disappear? Because the moment it disappears, now the child can proceed and hold on to newer objects as the child grows on. So that is why it should disappear by 3 months for it to achieve bidextrous approach, unidextrous approach, further on around 4 and 6 months. Next, coming to the parachute reflex. Now, parachute reflex, basically I had put here to tell you that most newborn reflexes are present at birth, but this is one of those reflexes which present after birth. That means this appears around 6 to 9 months of life and then persists throughout the life. Now, how do we elicit a parachute reflex? You take the child in prone position and then try to drop towards the floor. So when you try to drop or a sudden downward movement you give, the child will extend the arm in order to prevent fall on face or directly on chest. So the extension of arm is to break the fall or break the velocity of the fall. This is a parachute reflex that I and you, everyone will have. Now, this is the importance of the fifth principle of development, that is loss of newborn reflexes to achieve newer milestones. Like I told already, the palmar grasp should disappear to get bidextrous approach, then unidextrous approach, and then maybe a mature pincer grasp. The ATNR or the asymmetric tonic neck reflex should disappear to achieve rolling over later. Now, similarly, just like palmar reflex, there is something called as plantar reflex. That means when you touch near the ball of the great toe, the foot also contracts this way. So that is called as a plantar grasp. Now, plantar grasp disappears around 9 months of age. Palmar grasp disappears around maximum of 3 to 6 months of age. So plantar grasp should disappear so that the child learns to walk on foot properly. Now, what is STNR? STNR is symmetric tonic neck reflex, which is needed to disappear for a bare walk to happen. I'll tell you later on what is STNR and we'll have more photos for it. So that is about the fifth principle, which is very important, loss of newborn reflexes to gain new skills. Any doubts so far? Okay, so we'll proceed further with the next part of the lecture, that is developmental domains. Now, to assess that the development is adequate, we have divided developmental domains into major 5 domains. The first one being gross motor, the second one is fine motor, then is language milestone, then is personal and social and cognitive clubbed together. So it is in simple remembered as a social domain. The fifth one is vision and hearing. So these are the 5 domains, and we will go through the development of the baby through all these 5 domains. Now coming to more gross motor. Now in gross motor, what happens? So we all know that neck control happens around 3 months of age. So till 3 months, the neck control is almost nil, or it is just starting to develop. That is why when you pull the child sit, there is complete head lag and the back is rounded. So this is how it is. So when you pull the child, there is complete head lag. There's complete head lag, and if you make this child sit, there will be a rounded back. So now when you are pulling, it is not complete head lag, this partial. So this is around 4 weeks or 6 weeks of age. Now at 3 months, there is proper head control. At around 4 months, there is rolling over. So by 4 months, the ATNR should disappear and the child should start to roll over from supine to prone position. At this point of time, if you put the child in prone position, directly put the child on prone position, the face and the head will try to lift off the couch. However, the chest will still be in contact and the arm will still be flexed at 4 months. When you put this child on ventral suspension, the head will still remain above the plane of the trunk. That means when a newborn is put in a ventral suspension, it will be a complete lag. Then it will start in just momentarily holding around 4 weeks of age. By 3 months of age, because the head control is there, it will try to maintain at the horizon or the same level. And then at 4 months of age, it will try to lift the head above the plane of the trunk. So this is how the gross motor development happens. Then is at 3 months, meanwhile, with the fine motor, there will be hand regard. Basically, hand regard means what? Hand regard means the palmar reflex will disappear and the child will open the fist and start seeing its own fist and start playing with it. So this appears by 3 months and disappears by 5 months. Now there is a catch here. Hand regard doesn't need vision. That means hand regard is a milestone which is seen even in blind babies. Next, coming to the smiling at the image. Now, smiling at the image, when does it come? It comes around 5 to 6 months. That means child will go see the mirror. There will be a mirror play, and by 5-6 months, it will know that this is a mirror where I am seeing the reflection. So next, coming to the playing with feet. So once there is rolling over that has happened from supine to prone, then once it is prone, it will start getting the feet to the mouth, and this playing with feet comes around 5 months, and then feet will be taken to the mouth around 6 months. And this will disappear by 1 year. By 1 year, child will start walking, so it will no more take the feet into mouth. So this is, I think the slides just got switched. So the rollover, that is prone to supine, happens around 4 to 6 months, and supine to prone happens 1 month later, that is 7 months. That is your 6 months. Again, just to show in one picture, when you put the child prone, here you can see the arm is extended compared to the 4th month pic where the arm was flexed. Here the arm is extended and even the chest is off the couch. That means the chest, the neck and the head, all 3 components are off the couch. So at this point, the child is able to take the weight on the arm. That means you make this child sit. This child will sit with support. That is in tripod position. The child will sit with support. So after sitting with support, that is around 6 months. At 8 months, child will sit without support. That means lifting the hands, the child will sit aram se on its own. That is around 8 months. Then these are few special words that you have to remember. This is called as crawling. Crawling comes around 10 months of age. Now, if you go by English literature, crawling means when the chest is also off the ground. However, developmentally, crawling means the chest should be in contact with the ground. So the best way to remember is the military crawl. So in military crawl, the person drags himself further. So the chest is in contact with the ground. Whereas this comes at 10 months and then creeping is coming at 11 months of age. Now creeping means the chest and abdomen is off the ground. So this is creeping and this is crawling. Most commonly getting confused by most of the UGs and PGs. So the best way to remember is A comes first. So crawling comes first. So the touching of the chest will be there and this comes at 10 months and 11 months is creep, that is E comes next. So this is how you remember. Around the same time, we also get pivoting. Now pivoting means when the child is sitting, if you give an object behind or if you create a sound behind, the child will turn towards the source of the sound or towards the object to take it by stabilizing its trunk and lower limb. So this is called as pivoting. Now this pivoting also happens around 11 months of age. So I hope it's clear. The neck control happens at 3 months. Then the rolling over happens around 4 to 6 months. Then the child is able to take off the weight on the extended elbow and sitting with support, that is tripod position, comes around 6 months. Sitting without support comes around 8 months and 10 months is crawling, 11 months is creeping and pivoting. This is called as cruising. So after creeping, now the child will go towards the furnitures and will stand and will move around this. So this is called as cruising. So pulling itself to stand and slowly with the help of the furniture, it walks around the furniture. This is called as cruising. Comes around 1 year of age. Now, after, this is called as bear walking. Now, bear walking means just like how bears use all the four limbs, the baby also uses all four limbs to go further. So this is also coming around 12 to 13 months. That is 1 year to 13 months, bear walking. Now, these were special slides that I added just to make you familiar with these words which are commonly asked in Viva. So next is creeping. Now, after this cruising, the child will be able to stand on its own by 12 months. So you take a margin of 12 to 15 months and the child will be able to walk on its own. Then meanwhile, child will be able to stand on its own, sorry. Then the walking comes. So before walking, the child should know to creep. So by 15 months, the child knows to creep upstairs. So by 15 months, the child creep upstairs, and by 16 months, the 16 to 18 months, child is able to walk independently. Then these are few more words that are important. That is casting. Now we should know what is casting. Casting means the child will take all the objects and start throwing it intentionally. So you give a group of toys to the child will take it and then throw it. Now this is called as casting. So this comes at 1 year because child wants to explore more and more things, and generally disappears by 18 months by when child knows that this is the toy section and I have to keep it separate. So the followed by this casting will always be handedness. That means whether the child is right-handed or left-handed is generally known by 2 years of age. So by 2 years of age, we'll know about the handedness. So I think the slides have jumbled a little. So this is the pincer graphs that we spoke of. So at 12 months, the child will be able to stand with support. So it will be able to cruise around the furnitures also. It will be able to walk alone, but it will fall. And the child has a mature pincer grasp. So these are all there at 12 months of age. By 18 months of age, the child will have domestic mimicry and it will also start to run. By 2 years, so by 2 years, the child will have 2 feet at a step and it will go upstairs. Now the creeping upstairs was by 15 months. By 2 years, the child will walk upstairs by 2 feet at a step. Using 2 feet at a step. So 2 for 2 it is 2 feet at a step for 2 years. Now when we multiply 2 by 3, it becomes 6 blocks. I have other slides for this. So this is the motor milestone at 2 years. And then by 3 years, the child will be able to ride tricycles. And now the same stairs, it will go alternate foot upgoing. Whereas by 4 years, it will come downstairs by coming alternate foot. So downstairs comes at 4 years, upstairs comes at 3 years. Okay. So alternate foot going downstairs comes at 4 years of age. And also at 4 years of age, the child hops. Hops means it tries to jump with single leg. So the other leg is flexed and it is trying to hop. So the hopping as well as alternate foot going downstairs comes at around 4 years of age. So this is what is hopping. So at 5 years of age, child is able to do skipping also. So skipping comes at 5 years of age. This is the gross motor milestone. So just to revise one, it is 3 months neck holding, 5 months that is rollover. So rollover also first is supine to prone, then is prone to supine position. 6 months, the child sits with tripod position with the help of its own hand. It's not the support as pillow and all, it is the support of the own hand. Then at 8 months, it is sitting without support. At 9 months, it is standing. At 12 months, it is creeping, like I already told you, crawling comes first and creeping comes next. So 10 months, there is crawling. Then there is 11 to 12 months, there is creeping. There is walking and cruising also at 12 months. At 15 months, child will be walking and creeping upstairs. At 18 months, child runs. At 2 years, it goes upstairs 2 feet at a step. At 3 years, it goes upstairs 1 feet at a step. At 4 years, it comes downstairs 1 feet at a step and also hops. At 5 years, it skips. So this is grossly how you remember your gross motor milestone. So there's one more easy way of remembering this, that is rule of 3. So if you divide the body into 4 parts, this is the head part. So the neck control happens by 3 months of age. Next is your thoracic and the axial skeleton. The axial skeleton support comes around 6 months of age. By 6 months, the child will be able to roll over and also sit with support. Then the thigh and knee, that is around 9 months. That means the child is able to sit without support at around 8 months, and also able to do crawling and creeping by 9 to 10 months. By 12 months, it uses its foot. That is, it is able to stand on its own and even sometimes walk few steps on its own. This 12 months. So this is how you divide and remember by using the rule of 3. Next, coming to fine motor milestone. Now, fine motor means the usage of hand and skills to draw or scribble. So this is your fine motor milestone. Like I told, the palmar should disappear to get the bidextrous approach. So by 4 months, the child will try to grab something that is coming on its way. So that is called as a bidextrous approach. Unidextrous means by 6 months, when the child is able to sit with support, you give something to the child. The child will keep one hand as a support and take the object with the other hand freely. So this is your unidextrous approach. Next is at 9 months. So between 6 to 9 months, the immature pincer grasp develops. Now, immature pincer grasp means whenever any object is given to the child will try to hold with the ulnar aspect first. So with the ulnar aspect, using all the fingers when the child holds, it is called as an immature pincer grasp. Then on, it slowly matures so that it holds using only 2 fingers, that is thumb and index finger, which is called as a mature pincer grasp. Now, mature pincer grasp comes around 1 year of age. So by 1 year of age, the child will be able to hold any pen, pencil using only 2 fingers. So that is a mature pincer grasp. So by 15 months, now when it is able to hold the pen, now it will start scribbling. So plus 3 months, you remember it will start scribbling, and by 18 months, by 15 to 18 months, it starts scribbling, and by 2 years, it is able to draw line. It is able to draw line. Now for this, you remember this part. So you remember this is 1. At 1 year, it is able to hold the pen. At 1.5 year, it scribbles. You can see this is scribbled. So it is scribbled line. At 2 years, you draw one more line below. So it is able to draw strokes. A vertical stroke or a horizontal stroke comes around 2 years of age. And then at 3 years, you can make a circle, right? The red one is the achieved milestone. So at 3 years, the child can make a circle. At 4 years, it can make a plus. Now, plus is nothing but a cross. It can make a cross at 4 years of age. And at 4.5 years of age, it can make a square. So this is the half a square. So at 4.5 years, it can make a square. And when you write a 5, the child, this is a triangle. So at 5 years, it can make a triangle. So these are your fine motor milestones when you give a pen or a pencil to the child. Now, when you talk about blocks, the same thing can be checked in our OPDs or when we want to do developmental milestone by giving them blocks and other toys. So if we give them blocks, so at 2 years, 2 3s are 6. So the child will be able to build a block of 6. So that is 6 blocks. At 3 years, it is 3 into 3 again. So at 3 years, it is able to build a block of 9 blocks. So at 4 years, using the blocks, it can make a bridge. Now the cross looks like a bridge also. So it can make a bridge. At 5 years, now there is a triangle. Then imagine it like a gate which flips open. So it can make a gate also with blocks. So this is how the fine motor milestones evolve after 1 year of age. So the best way to remember it again, if this section is all NEET PG. So the scribbling is learned by 1.5 year of age. Then at 2 years, there is a line which is drawn. At 3 years, there is, so this is the mnemonic which is there, LOX STD. Okay, so LOX STD means line is at 2 years. Before that, there is scribbling. So 1.5 year pace scribbling. At 2 years, there is line. At 3 years, there is circle. At 4 years, there is cross. And then at 4.5 years, there is a square. And at 5 years, there is a triangle. 5 years ke baad, we generally don't remember. So that is why it has become a NEET PG question. So at 6 years, there is diamond. A diamond drawn is around 6 to 7 years. So this is how you remember this mnemonic, that is LOX STD. Now after 7 years, 8-year is not counted. So 8-year is counted as a plus. So when you draw a plus in a 3D picture, you have 8 corners. 1, 2, 3, 4, 5, 6, and 7. So there are 8 corners. So this is drawn at 8 years of age. And when you draw a 9, and if you join this, it becomes a cylinder. So a cylindrical structure is drawn around 9 years of age. And at 11 years, there is cube which is drawn. So I hope this makes the thing simple to remember. Fine motor skills. Is it clear or should I repeat? Shall I proceed further? Okay. So this is okay. So this is how you can remember your fine motor skills. So next coming to, in the fine motor skills, only first 4 you will have to remember properly. That is 4 months bidextrous reach, 6 months unidextrous reach, at 9 months there is immature pincer grasp, at 12 months there is mature pincer grasp. Then on you can just remember this mnemonic and write up the fine motor skills. Next coming to the language milestones. So how does the language develop? For this also there is a very nice mnemonic. So this is how you remember it. So at 1 month, there is only some sounds which are produced by a newborn. At 3 months, the child coos. Now, coo has 3 words. So it comes at 3 months. At 4 months, it laughs. So ha ha ha. So ha ha has 4 words. It is 4 months. At 6 months, it babbles. So babble word has 6 letters. So it happens at 6 months. At 9 months, it does imitation. That means whatever you talk, the child will try to talk. So that imitation is a long word containing almost 9 words. That is why it comes around 9 months. And at 9 months, you should also know that the child waves bye-bye. And at 12 months, it is 1 to 2 words. Oh, just put a dash here. So it becomes 1 to 2 words. Now at 18 months, ideally a child should have a vocabulary of 18 words. At 2 years, it should talk sentences having 2 words. That is, give me, I need, I put. So this kind of 2-word sentences, 2-word phrases, the child should be able to talk. At 3 years, it should be talking 3-word phrases. For example, my name, this is 4-word. My name Laxmi, I am a girl. Why am I giving this example? Because at 3 years, child will know its name and child will know its gender also. So this is how you remember the 3 years ka language milestone. At 4 years, child will know 4-word phrase. So 4-word phrase is nothing but the simple poems also. So that is why at 4 years, it will know poems and stories. And at 5 years, the child's inquisitiveness increases. It starts questioning everything around the environment that the child has. Okay, so this is how you remember your language milestones. Now coming to your social milestones. So social milestone means how does the child responds to its environment. So for this you should know what is a smile. So all newborns smile, but they smile only in sleep. So generally we tell it as dreaming. So a dreaming smile. That means generally they smile only when they are dreaming. So at 2 months, the child starts having social smile. That means the child smiles when the mother talks to him or her. So smile after being talked to is called a social smile. At 3 months, child starts recognizing the mother and it will anticipate the feed. At 6 months, child recognizes this is not mother, this is someone else. Starts recognizing strangers. So by 6 months to 9 months, we get stranger anxiety. And at 9 months, the child waves bye-bye. Okay. And at 12 months, the child comes when called. So because at 12 months, child is able to stand, when you call the baby, the child comes to you. At 15 months, there is jargon speech. That means child continuously talks. So that comes around 15 months of age. So at 18 months, the child starts copying. Whatever the mother is doing, it will try to do. So that is 18 months copying. At 2 years of age, it will start asking for food. So at 2 years of age, the child knows that whatever is happening around, the child also should follow that. If all are eating, let me eat. I have my own needs. I want to go to susu, potty. Everything comes around 2 years of age. So generally by 2 years of age, the kids are also dry by night. That means the child will tell try by day. So the child will tell that baby is having wanting to pass urine, so it has to go to washroom, and it will take the parent along with it, and not just pass in the diapers. So that is by 2 years of age. By 3 years of age, like I told, the child will know its name and gender. At 4 years of age, child will play cooperatively in a group and then go to toilet alone. At 5 years of age, it starts dressing and undressing and also helping in household tasks. So because this is a little complicated, I divided it in few months. That is, at 9 months, the child will, along with bye-bye, we always ask for a blowing kiss. That is, a flying kiss is also given by the child. And when asked to clap, the child claps. So the clapping, the flying kiss, the bye-bye comes around 9 months of age. And at the same time, you can play this game of peekaboo. That means when you close the face and then show the face again, the child squeals with joy and laughs. That means peekaboo tells that there is object permanence. Till 9 months, whatever is in front of the baby, that object is there. Whatever is not in front of the baby, the object is probably not there. That is what the baby thinks. Object permanence means even if the child is not seeing mother or an object, it still believes that the object continues to stay behind the obstruction or behind the wheel, behind the cloth that is used for peekaboo game. So that is the meaning of object permanence. Now finger play, that means if you give toys to different fingers and say this is mama finger, dada finger, and try to explain, at 9 months, the child will be able to play using fingers. So that comes around 9 months of. Yeah. So at 12 months or 1 year, the child will come when called. It will kiss you on request. And when you give a toy or a ball, it will start playing the ball game also. So this is also one important social milestone. So at 18 months, I told you there is domestic mimicry. This is also called as domestic mimicry. That means most of the time, the child spends with the mother, so it imitates parents. And whenever there is another child, it will try to enjoy the company of other children. Okay. Following this, another 4 months later, there is something called as parallel play. Parallel play means kids play on their own. So if there are 3-4 kids in a room, or say there are 2 kids in a room, both kids can play separately without getting disturbed by each other. Probably that is the reason by 2 years you can put your child for a play home, because they have achieved this milestone of parallel play. They play on their own. And by 3 years, they know that they have to wait for their turn. Say there is a common game that is being played, they should wait for their turn to play the ball. So this is what is understood by 3 years. And at 3 years, they also know to share their toys. At 4 years, they play cooperatively, and at 5 years, they will help everyone in household tasks and dressing and undressing. There were actually few videos. I couldn't add it in the slide. Maybe just before the next class, we will revise these milestones by playing those videos. So are the milestones clear, or did I confuse you more? So just for a quick recap. So now the gross motor milestone, you remember by the rule of 3, and then the creeping, crawling, walking, cruising, the new words that we have used, walking up and down stairs. Am I audible? Sorry.
Yes, ma'am, audible.
Yeah. Okay, so gross motor milestones, you remember by the rule of 3, that is neck holding first, then sitting with support, support by 6 months and sitting without support by 9 months. And then the bear walking, the creeping and crawling that comes between 9 to 12 months. By 12 months, the child should be able to stand. And by 18 months, the child should be able to run. At 2 years, the child will go up the stairs by 2 feet at a step. By 3 years, up the stairs by 1 feet at a step. By 4 years, down the stairs by alternate feeting, and hopping by 4 years. So at 5 years, the child skips. So this is your gross motor milestone. And fine motor milestone, you just need to remember till 12 months. That is bidextrous approach by 4 months. By 6 months, unidextrous approach. That is using one hand, the child will take the object and then try to transfer to the other hand. Then by 9 months, there is immature pincer grasp, and by 12 months, there is mature pincer grasp. After 12 months, you can just remember using this mnemonic or a simple method of telling, where at 2 years we have lines or strokes, at 3 years there is circle, at 4 years there is cross, and 4.5 years there is square, and 5 years there is triangle. And if interested, for neat purpose, you can remember this also. So, and then for the language milestones, very simple to remember using the appropriate words and that many number of months. So, cooing by 3 months, laughing or ha 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 by 4 months, babbling by 6 months, imitation by 9 months, and 12 months 1 to 2 words, 18 months 18 words vocabulary, 2-word phrase at 2 years, and 3-word phrase at 3 years, and 4-word phrase at 4 years. And then you have a social milestone. So social milestone starts with smile at birth, social smile at 2 months, then at 3 months recognizing mother, at 6 months there is stranger anxiety, at 9 months there is waving bye-bye, at 12 months there is at 9 months there is along with the bye-bye there is clap, there is flying kiss, there is fingers play, and there is peekaboo game that can be played. At 12 months there is coming when called, and then a kiss on request and ball games that can be played. At 18 months, there is domestic mimicry and enjoying with other children. At 2 years, there is parallel play. That is why you put the child in preschool. At 3 years, they take turns. At 4 years, they cooperatively play. Now, just to revise, I know this is a little exhaustive, so I've tried my best to make it simplified. Next class, I'll just play some videos so it becomes a pattern in how the development progresses. So can you tell me what is this? Anyone wants to attempt? What is this? There are more questions I can see. Moro is done. Yeah, Moro is a very important reflex that we see at birth. So if Moro is complete, then it is a term child whose CNS is intact. If Moro is incomplete, if it is a premature child, then it is okay. But if it is a incomplete in a term child, then we have to rule out many things, including CNS damage and some rib fracture or a clavicular fracture and other local causes also. So Moro is followed. 2-word phrase. 2-word phrase means give me, I want, food, bhook lagi, aisa bolega. Like for example, the child will show the ball, give me. Child will show the food and tell hungry. So just 2-word phrases. That means a sentence having 2 words. So these are your 2-word phrases. Okay, 1 second. How to calculate DQ practically if only some milestones achieved, numerator, especially if child is 2 months or 4 months. Okay, see, DQ is a part of evaluation of a developmental delay. I will touch on this with the details once we start discussing developmental delay. दोबारा बता दूं, मदर रिगार्ड, देयर इज मदर रिगार्ड बोल के वर्ड नहीं है, the word is hand regard बोल के है. So hand regard is when you see the hand and the child is just seeing the hand and playing with its own hand. So this is called as hand regard, but against the expectation that this needs vision. So generally what happens, if a child is seeing the hand, you believe that the child is having a good vision and that is why it is seeing the hand. But it is not so. The hand regard is seen even in blind babies. So that is not the truth. So hand regard is not related to vision. This is one important thing that you have to remember. Okay, dobara bata do. I think I just revised. I'll try again. Wait. So you try to answer the quiz. That is how we can revise it. Can I have some answers? What is this? What is this? The child is smiling to someone. The mother is trying to talk, so the child is smiling. So what is it? What is it? Sorry.
Social
smile. Correct. So it is a social smile. In response to something, the child smiles this social smile. At what age is it achieved? At what age is it achieved? So it is achieved around 2 months of age. So 2 people are there. So you remember it as 2 months of age. Okay. So what is this? Can anyone tell me what milestone is this?
Sitting with the support. Tripod position.
So it is a tripod position. Child is able to sit, but only after taking support from the hand. So this is sitting with support. At what age does this come?
6 to 8 months. 6 months actually.
By 6 months, yeah, you can give a range always, not a problem. But by 6 months, the child should be able to sit with support. So what is this? So here also there are support. The pillows are there. Am I audible? Sorry.
Yes, ma'am. I think this is also sit with support.
Sit with support.
So this is not sit with support. This is sit without support. You can see the support is not taken. The support of the hands is not taken. So that's why I wanted to show you. Support means support of its own body it takes. It doesn't take the support of the pillow. So the moment the tripod position is disappearing, the child takes both the hands off and then can do all the things. So this is sitting without support. What is this?
DP. Upstairs.
Yeah, so this is creeping upstairs. So this starts time?
15 months.
15 months, correct. So this starts around 15 months. So just so that you remember all the 9 months milestone, can anyone tell me what all happens at 9 months? One of the milestone the child is showing here.
Waves bye-bye.
Yes, waves bye-bye. Then?
Immature pincer grasp.
Correct, immature pincer grasp. Then?
Imitates.
Correct. No, okay, fine. Tries to imitate. Okay. Imitation, correct. Then? So it claps also.
Creeping.
The child claps. Okay. And also gives a flying kiss.
Crawling around 10 months. Okay.
Correct. Crawling around 10 months. Fine. So these are all few milestones that you have to remember at 9 months. So these are the 4 main domains that are there. Like I told, there is the 5th domain also, which is very important. That is vision and hearing. So for this, you should know how does a vision develop. So now vision starts developing as early as 29 weeks. That means at 29-week old premature child also has pupillary response. By term or at a normal birth, the child tries to follow the object or the person. But this following of the object is not more than 45 degrees. At 4 weeks, that is at 1 month of age, the child tries to follow around 90 degrees. That why this degrees are important is because in the next class, when we learn about the developmental assessment, this will come into importance. So for now, you just remember that at 1 month up to 90 degree vision can be checked. And at 3 months, it follows till 180 degrees. And at 3 months, it also fixates on a person and a nearby object. And doll's eye, which is present at birth, disappears by 3 months. Now, doll's eye means if you take a Barbie doll or any play doll that we have and you try to move the head of the doll, the eyeball will always lag. That is because the CNS and the coordination has still not developed well. So the eye always lags behind and then fixates to the side where the head is turned. So this maturation of CNS happens around 3 months. So by 3 months, doll's eye disappears. At 4 to 5 months, hand regard comes, which doesn't need vision. At 6 months, the child adjusts to seize the objects. That means depending on how the child is made to sit, it can either bend or crouch to see the objects. So this is the importance of vision. So if these milestones come, then the vision is normal probably. Next, coming to the hearing. So hearing can happen as early as 24 weeks. Now this is the famous story of Abhimanyu that we know that he has heard the Chakra Vyuha when he was in utero. So that was around 20. This is almost proven also that by 24 weeks, the child starts hearing. Yeah. So we just talked about the vision, then coming to the hearing. Now, I was just telling from the age-old time, we know that Abhimanyu had heard the story in utero of the Chakravyuha. So it is almost proven also that at 24 weeks, hearing is established. Now, in the current era, why is it important to us? Using few devices like vibroacoustic stimulation, we can even diagnose the congenital deafness at the earliest and directing them to treatment as early as they are born. So at 24 weeks, hearing starts. A newborn child startles. That means it gets scared. It does movements and then cries loudly. The moment there are loud sound. So at newborn period, we check it by startling reflex. And then there is something called as Murphy's law of sound localization. That means the child tries to find the point from where the sound is coming. So this is called as law of sound localization. At 3 months, the child turns to the side of the sound. At 4 months, it turns towards the sound, and even the eyes follow it in the same direction. At 5 months, it turns towards one side, and if the sound is coming from downwards or the source of sound is below the ear, then it moves towards the eyes move towards that source. So the downward localization comes around 5 months. The upward localization. So if any sound is produced above the level of the ear, it tries to track it at 6 months. So the downward localization always precedes, followed by upward localization. And then by 7 to 8 months, it curves in an arc. That means it tries to follow the arc and the entire body can turn towards the source of the sound. By 8 to 10 months, like already shown, it pivots and turns diagonally towards the source of sound. By 1 year, a child is able to localize the sound as good as adults and may even try to adjust it according to control his environment. That means at 1 year, child can learn selectively to ignore few people's voice or even ignore few sounds. So that ability is also achieved as early as 1 year. So this is about a normal development in a child. Next class, we are going to deal with all the professional competencies that you are expected to